well, with that, 2 minutes past, I think we can get started. I'm sure people will continue to trickle in. So welcome. Thanks everybody for joining us. My name is Chris Vogel. I am the co-chair of the Atlanta Area Evaluation Association's program committee, and this is one of our program offerings. I think about 3/4 of the people that signed up for this webinar were from all over the country, so thank you for joining us wherever you call home today. A little background on this presentation, well, besides the fact it's titled Evaluation Advisory Groups Constructing Bridges for Collaboration. This started a year and 4 months ago even, at the 2018 Canadian Evaluation Society Conference. I believe Jean was the one that organized it to be a roundtable, and those of us that were interested in this topic joined the roundtable, and we really kept the conversation going long after the conference was over. A year and 4 months, it's still being talked about. And then we worked on it through that year, the 2018-2019, doing an extensive literature review, trying to inform our own understanding of what it was, and put our own experiences in context. And then we submitted this as a panel presentation of the 2019 Canadian Evaluation Society Conference, and it was one of the leading edge panels for the conference. And we've continued to work on it since after that, and we thought it'd be a great offering for the local affiliate of the AEA here in Atlanta, and to open it up to everybody else. So that's kind of where we're at. I'm trying to think if there's anything else I should tell you. No, that's about all. We'll get into at least our experiences with EAGs as this goes on. But unless there's anything Margo or Jean wants to chime in on? No? Okay. Well then, we will get started. Slideshow from beginning. Can people, well, I should ask, people can hear me and see me okay? Nothing too wild? You can just type it into the chat box. Make sure you're seeing that before I hop too far into this. Oh, good. Okay, so at least one person can. And hopefully you can hear me too. So with that in mind, let's get started. So the first question, probably any good webinar should start out with. What are you hoping to get out of this webinar? We would like to hear from you what pieces of information you're hoping to learn, so to make sure that we're touching everything that you wonderful folks need to know from this, get out of it. So just feel free to type it in the group chat. We'll open up the audio later. I'm sure you know audio can get kind of intense on webinars, so feel free, type whatever you're interested in the chat, what you're hoping to learn, and we'll do our best to make sure we address all those topics. Good one, Jean. Yeah, so I should say that this is slowly but surely becoming a manuscript, and we're hoping to continue to inform what we're writing by you all's experiences. So definitely chime in during the discussion and tell us all about the good, the bad, the ugly of EAGs. And from Tanya, new insights. I hope we can deliver on that. I'm hopeful. Awesome, working on developing an MLEKM advisory group. I want to learn how others got started, what to look out for in member selection. I'm glad to see that one, because yeah, that we definitely touch on several of those. Anybody else with what they're hoping to learn? Yes. Luella, if I'm saying that right, as a nonprofit service provider, I'm looking to establish an advisory group of evaluators to strengthen our evaluation modeling tools, that expert evaluation advisory groups. That's a classic and a good one. Yeah. All right. They currently have an evaluation stakeholders group, so interested in learning new ways to utilize this group. Okay. I like it. Well, hopefully we can give you all sorts of insight on that. All right. Well, with that, we'll just hop right into it. This presentation is really broken up into 4 different sections. What is the overall purpose of evaluation advisory groups? The structure and composition, so right, what do they look like? How do you put them together? Things to keep in mind while they're running, the processes that should be taking place, but also how power is impacted or impacts evaluation advisory groups. And then probably the one everybody loves talking about the most, the pitfalls, things to avoid, those horror stories of evaluation advisory groups. Okay, and Jean, I think this is you, right?
It is.
Okay.
Is everybody able to hear me all right? Maybe somebody could just type in a little text to say they can hear. Thanks. Carry on. Okay, great. So Jean Krupa, co-principal and senior evaluator with Catalyst Research and Development. And in my, just about to enter my 5th decade of work in evaluation. It sounds like a long time, but basically my background is in public health though, and I've retired, and now my wife and I have this company called Catalyst, and we have about 50 associates that we work with depending on the geographic area, the language, and the topic area and the evaluation methodology. And for the last 10 years or so, we've operated this company and became progressively interested in the sort of hidden resource or untapped resource of evaluation advisory committees or groups. And then once we started to discover it, we thought that it was really important to develop it. So my section's about the context and the purpose. And we work with some long-term projects, 4 to 5 years, a lot of projects that are oriented toward public health prevention, health promotion, and human services in various sectors. And we do some things like try to improve utilization, beginning with utilization in mind, each project, and some things that maybe help to meet needs for, the kind of language people need for utilization. So we have done a number of social return on investment type of analyses. And in each of these, as we reflected back, there are various points at which we thought we could have, done better with evaluation advisory groups. Every project had an evaluation advisory group, but some were established by the client prior to the work we did and had certain expectations, and some we had the luxury of designing and building ourselves. So if you could give me the next slide, please, Chris. So yeah, so it became clear quite quickly that we needed a clear sense of purpose and how this purpose was achieved and was to be achieved in the context we had in order to drive the other decisions around structuring the committee. So, if we didn't have the purpose quite right, then we might not have the right members and roles and expectations. We might not structure it and appropriately. We might not build the capacity that we needed to really optimize the evaluation and the utilization of it. And we might not have asked for the resources, the time, and sometimes the money to make this advisory or expert committee or consulting group or whatever it was called in the end to really enhance the evaluation and its utilization. So we began early on in focusing on getting the purpose clear, communicating, making sure that was right, but then also allowing the purpose to grow and change as we went through the project. And the next slide, please, Chris. So in order to really optimize that evaluation and its impact, we looked at what kinds of purposes could it have. And the next slide is some of the purposes. So how could we make this evaluation most appropriate? How could we get the best quality of evaluation? And that's methodology and data collection processes and the best quality data. How could we ease navigating? We had to operate with various stakeholders in various circumstances with a wide range of possible contributions and limitations. How could we get this committee to help us in validating the process and the products so that then they could speed into utilization? And how could we get other eyes and ears on things to generate implications and recommendations that grew out of the data? Ultimately, how to best utilize the evaluation for precipitating real change in practices, processes, policies over the long term. And number 7 is about capacity building. So would it be possible even to use this advisory committee to build its capacity and an ability to advise in the longer term with increasing wisdom, and also then to build the capacity of the members of the committee so that then they could get back to their organizations and strengthen the capacity there. So a lot of the projects we do are intersectoral, oriented to addressing determinants of health and upstream of the actual health issue that the innovation is addressing. But we need to kind of grow the capacity of all those organizations along the way. So a few of the purposes, and next slide, please, Chris. And this guy is just to symbolize that some of the nuts are tough to crack. And so we're trying to get these progressively bigger beaks capacity to break through those areas that are tough, so that we can really kind of optimize and harmonize with the kinds of processes and directions and capabilities at the end that we need to really use the results of the evaluation. Next slide. One in particular that I wanted to highlight was about navigating, and this theme of increasing our ability to navigate systems, logistics, on our way to utilization. And I'm really emphasizing utilization here because in my early days, we did lots of evaluations that sat on shelves and kind of fulfilled the accountability need, but didn't fulfill learning needs and sustainability needs and institutional and system change needs that we needed to fulfill. So when we went to work with vulnerable populations and reluctant stakeholders and wanted to be more serious about our results enduring and being used, we needed some help in getting the best possible data collection methods and tools, but also opening the doors to those systems and subsystems and individuals that could constitute barriers but also to engage them. So engagement is a big theme for us, and EACs really, we tried to develop those so that they could be very, very helpful in getting the evaluation where it needed to go. Along the way, generating those more clear implications and more helpful and actionable, appropriate recommendations, all in preparation for utilization. Because our members of that evaluation group or committee, they could see from the inside what we were having trouble seeing from the outside. And then they could also step outside their organizations and have the group kind of let the group speak to the organization back, rather than them as an individual, a single individual talking to their own organization. And we found that, that ability to look and speak from the inside, and then kind of enable the committee or the group to speak back to their organization about, how they could contribute, or how they could better participate was very, very helpful. Finally, boosting the utilization of results and recommendations, even evaluations that have great methodologically, can face tremendous barriers in the knowledge utilization phase. And we're quite serious about that. We don't really undertake projects anymore where there appears to be barriers. And if barriers emerge to utilization, we negotiate heavily to try to address those. So EAG members can help to navigate that final stage and facilitate, transfer the knowledge and recommendations back and forth with their organization. So we're really, wanting to move that evaluation from, take it from the page to the practice and policy, and enduring system change. Next slide, please. So, it came back to, could we establish those purposes really clear? So, thinking back on those 7 that I had on the slide, and could we then, establish those purposes in a participatory way with the committee or group, and then have them really own those purposes and drive them forward, and have, as possible, their voices in a kind of a co-design mode to make that evaluation advisory really suitable, appropriate, aligned, harmonizing with their purposes. Next slide, please. And all for the sake of allowing that evaluation to take root and grow and be productive, as it were, and its impact would be there. And I guess I can't say that enough, and I'm saying it probably too much, but that's what we're interested in, is the end. And then how can the process be such that the EAG member or committee member is engaged throughout, finds the useful things that they can do, learns and grows through the experience, has a sense of satisfaction through it, and isn't just sitting there and taking up time and wishing they were somewhere else, or all, that sort of thing. And so the last slide is the question that we came to and continue to come to and ask people in the evaluation advisories along the way, is how well does your evaluation advisory design reflect or reinforce your purposes? That's on the next slide, please. So how does it reflect? And this is, I guess, the question that I'd leave you with, and now we'll go to just a very brief discussion time, things that come to your mind, and you can use a text chat. But how well does your EAG or C, whatever you call it, design reflect and reinforce your purposes? And in what ways does it not? And so if you'd reflect on that question, and you can hold the question, you can live the question for the next little while, and then you can live it through the rest of the presentation. But sometimes we have great composition and structure, but it just doesn't meet the purposes. So there's also this second question within that: in what way does it not meet the purposes? Now, you don't have to put those ideas here, but you can note them off to yourself on the side, but just to begin your reflection. But perhaps you have some questions and issues you'd like to raise just in what you've heard so far. So I'll pause here and just go to the next slide, please, Chris. Yeah, and in addition to your questions and issues, you might suggest, like, what did we miss? Did I miss out on a purpose that that is quite clear to you, or that came up in your thoughts? So what are your thoughts and questions? And the last slide is just a thank you. And that's my email address if you'd like to communicate further. Over to you. It's your turn. We've got a couple minutes, I guess, to look at things that arise in your minds.
Okay, thank you, Jane. Great. I'll leave it open a little bit if anybody has any thoughts, or I hop into my section.
And if you don't have thoughts just now, that's okay. Sometimes it takes a while to gel, but we'll have a bigger discussion at the end. So the design is each of us are going to take about 15 minutes with the questions, and then we'll be left with about 20 or so at the end for a broader discussion.
Okay. Well, if that's the case, then I'll hop in.
Yep, please do.
Thank you, Jane. So yeah, who's around the table? EAG structure and composition. So really the overarching purpose of my section is to talk about what the literature says about the structure and composition of EAGs. And I'm going to sprinkle in my own experiences, what's worked, what hasn't worked for assembling them. So roadmap of what we're talking about, the types of EAGs, who is supposed to be on the EAG, who should we include, what are some special considerations about facilitating EAGs, what different roles can possibly exist in the EAG, and then in particular, what's the evaluator's role, which is something that I feel like until I got into literature, I never even really thought about other than to help facilitate it and provide guidance on evaluation itself. So we'll get into that. So I just got to go back a little bit to the types of evaluation advisory groups, back to what Jane was saying, because it really is driven by the purpose of the evaluation. And the most common, or at least that I hear in the general talk around the AEA world, is these three breakdowns, or these three groups, that you want extra expert evaluation input. These are the expert evaluation advisory groups. So people that you would bring together that are experts in either the type of methodology you're using, the population that is the recipient of the program, or even somebody that has done an evaluation on that particular topic before. And you meet with these individuals to help you think a lot of times about what's the best way to approach the evaluation. And then the next one that's often talked about is this idea that you as the evaluator might not have all the requisite knowledge to be able to do the best evaluation possible. And here we're not really talking about evaluation expertise, but rather about this technical or even professional advice. So an example I would throw out there is you got a bid to do an evaluation of a new mine safety program. I know nothing about mine safety. I know nothing about mines, and I would probably need an expert evaluation advisory group to even help me do that. But I would also consider putting together an evaluation advisory groups of people with technical expertise in mines to make sure that the indicators I'm developing are even feasible. The evaluation questions make sense in the context. All of these more specific aspects of the program and its context. And then also participation from intended beneficiaries. I feel like this is really common and maybe not common enough, depending upon who I'm talking to. Those people that are intended users of the program, those people that would benefit from the evaluation, which really can include a whole bunch of people, to help you understand what their needs are, and understand what what value means to them, right? That determining merit, value, and worth can mean something very different from the person funding it to the person that's actually a beneficiary of the program. So making sure that their voices are heard in this process. And although these are the biggest three, other ones came up in the literature as well. There's talk about a steering evaluation advisory group. So a little bit different from the expert evaluation advisory group, although it may have experts in it. It can very well, probably does most of the time, have funders, organizational leadership to ensure that the evaluation is answering the questions that it should to meet their purposes. And I'm trying to think, and then really this idea of a stakeholder evaluation advisory groups, I probably don't have to tell this audience, but stakeholders is such a broad term that it could mean almost anything, but it can get very nuanced given your context. One that I loved in the literature, an evaluation advisory group done in Ireland of a museum exhibit about the Troubles. So, right, the conflict between the Protestant and Catholic North and South in Ireland. Their evaluation advisory group were stakeholder evaluation advisory groups, but it had people that were on both sides of that troubling times. I don't know what the best way to say that is, but people that were involved in the fighting, community members that had a large stake in how this was perceived. So even something as powerful as that, I feel like, is important to understand what the purpose of the evaluation advisory group is, and then to fill that with people we need. And for that context, it was to ensure that the evaluation had credibility. So what better way to ensure you have credibility than have equal representation from both sides of a bloody conflict on it? This is one I often ask myself. So when does there need to be more than one? In my previous life, I ran the National Evaluation Center for the National Network of STD Clinical Prevention Training Centers. And we trained about 25,000 clinicians and healthcare workers a year through 8 regional centers, providing trainings across the country. And it was a massive evaluation. And depending upon how you slice and dice it, we were always running 3 evaluation advisory groups. We had the expert evaluation advisory group, the funders evaluation advisory groups, and then people that were actually running the network. We brought them together often to talk about the evaluation. But I have to throw this out there that they are a lot of work, and that's another thing I probably don't have to tell you. But once we get down in the roles, you're going to see that it does take quite a bit of people to ensure these things are running effective and efficiently. And the more time you put into evaluation advisory groups, the more time you're taking away from survey design, data collection. So to be really mindful of that true purpose again. I keep going back to Gene's comments here, but if it's not that important to have funders, that it's more important to wrap your head around the technical aspects of the program. And you only have a limited budget, maybe the technical evaluation advisory group is the way to go. However, what I see in a lot of instances, and it works fairly well, is where it's really a mishmash of them, right? You'll have 1 or 2 other expert evaluators on there. You'll have a technical expert on there, a couple funders, a few people from your organization or the organization that's leading the effort. So don't get stuck in this idea that they have to all fit into this one mold we've been talking about. But they can definitely be a diverse group of people in all aspects. Who's at the table? I would go through the literature and I just kept pulling out what the different articles talked about. Either they had included or they recommended including. And this was really a shorter list than I actually pulled out. It just became unmanageable and I had to make cut off somewhere. So this should give you an idea of the level of diversity that can exist among evaluation advisory groups, from funders, advocacy groups, policy people even. I don't think I've ever done one that has included policy individuals on it, being very programmatic focused with my evaluations. But if policy is an important part of the evaluation, then that would be vital. So just something to think about. Extra, and now we're getting into stuff I learned as we were reading through this. The EAG might be constructed in a way that the members aren't even primary stakeholders or users of the evaluation. This kind of blew my mind when I read it the first time. But this idea that having an EAG where people aren't emotionally invested in it can be beneficial. There are benefits to that. And here's a couple of examples what I pulled out. When primary stakeholder groups take opposing positions on an issue and or are in conflict. When you try to form an EAG over a given evaluation and there is nothing but heads butting the whole time. Well, maybe it's time to take a step back. I would like to think that I would have the facilitation skills necessary to be able to deal with that, but sometimes either my facilitation skills aren't good enough or it's just not doable. The topic is so heated. Also, when expectations the clients for the evaluation aren't really realistic and need to be adjusted, that maybe you're an internal evaluator and you're voicing this isn't enough, but getting those outside expert evaluators to chime in unison and say, well, for this amount of money, they want you to do all that, that's unreasonable, and you could take that back. But you could see other instances of that occurring as well. Now we're getting into the nitty-gritty of it, right? How many people per EAG? There was really no consensus on this point. The numbers ranged wildly. I'd say the whole range was about 2 to 14, depending upon what article you were reading. 6 to 14 members was a pretty common group, which I've gotten up into about the 14. I think it got up to about 20 actually, and it was almost unmanageable. A lot of people wouldn't speak up, and then you just have the same voices speaking again and again. The most common range I saw was this 5 to 7 number. And just as my experience with facilitation, I'd say that's about a good group right there. My focus groups often don't get much bigger than that. So it ensures that there's not too many conflicting voices, that you can actually let everybody talk. You can use those facilitation skills. And that if people are missing, right, more than often, or more likely than not everybody from your AG will attend every meeting. So being able to still make good decisions with just 1 or 2 of them. And my answer, I have to go with 5 to 7 usually, but it depends on the group and the purpose. Funders, maybe them all. And if you have a lot of funders, that might be a problem, but especially if it's a significant project, they will want to be sure that their voices are included in this, and at least giving them the option to be included. Let them be the ones to opt out of it. So just keep that in mind. Evaluation experts, I would say only a few. I actually haven't had a large one with that, but I could imagine, just like any expert group, the more experts you get in a room, there's likely a difference of opinion on a lot of things. And even in small expert evaluation advisory groups, I found people very strongly advocating for one methodology over another, and they could get very heated about that. So I would say mostly 5 to 7. And I see some questions pop up. Is this in line with the AaEA evaluation committee that currently exists? I don't know what you mean by that. The AEA? Are you talking about the local affiliate or the national organization? It sounds like this preceded that committee. Is that correct? I don't really know. I don't know if an AaEA evaluation committee, other than the one we have for our pro bono work. But AEA, I couldn't tell you. We haven't, we sent out a couple calls on eval talk for people to talk to. But other than that, what are ways to ensure, and then the other question, what are ways to ensure participation in the EAG? or recruit the right people at the table. The recruiting the right people, I promise I'm getting to. I spent a few slides talking about that. But ensure participation in the EAG. Every EAG I have had has been over the phone. And it's just those classic facilitation skills. That if that person is speaking too much, you acknowledge the importance of their voice, their comment, and very nicely, I always have to put that out, and with as little tone as possible, say the classic line, and now what do other people have to say about this? And that's where I think facilitation EAGs, that skill is probably the strongest one in the EAGs. Technical evaluation expertise is great, but if you don't have a strong facilitator in there, this can all go awry really fast. So I highly recommend that AEA does tons of great facilitation workshops before the conference, maybe even after the conference. I don't remember any Saturday ones, but just any facilitation tips that exist around working in those groups, I have found to be effective. It gets a little wonky once there's a power difference between them. And then another question, also any strategies to increase, as some people can already be burdened by meetings. Strategies. Oh, to increase attendance. If I'm reading increase attendance, I'd keep them short. Our expert evaluation increase interest. Oh, sorry, yes. That's a good question. I think almost every EAG was something we had written into the request, the RFP, the grant reply. So it was required of the programs to be participating in it. But there were some, I think, like the Expert Evaluation Advisory Group, none of those people that had to be on there. They were all from outside the program. And they were professors of evaluation, I'm sure had bigger things to do. And it was really making a strong case for it, that, you know, these were all individuals we had a previous relationship with, that they understood the value of the work we were doing. So it didn't take much effort for them to get involved. I will also say, depending on the group, and I'd say it's most groups, unless it's employees, then it's a little bit different. You should find a way to pay them in some way. And a lot of times it's a formal process where it may be $1,000 for the year. And then for other groups where we couldn't do that, it was gift cards and thank you notes. Any way to continue to get them involved and show you appreciate them. So how do I get these people? You see, I told you I was going to talk about this. Around the table, recruitment's a critical process. It can be very time consuming, especially if you don't have those pre-existing relationships I was just talking about. So asking other organizations, other partners, other people working on the same stuff you have, who are people that could help us inform this evaluation? Who could give us context for this program? This is stuff that I had to admit I haven't done, but the literature talks about. Use publicly available info, board member lists, community directories, see who the heavy hitters are in your community, or the population that is being served by your program. Newspaper articles I thought was interesting. They talked about finding people that had written editorials in the newspaper related to their topic and reached out to them. So really any way you can find these individuals, that's at least a good starting point right there. From there, the literature talks about it's fairly easy to snowball, that snowball methodology, usually for sample collection, data collection. But then once you find a few good people, they probably know a couple other good people too, so asking them. This was talked about, the second bullet point was to increase buy-in from these fine folks. Consider implementing an application process. The psychology behind the idea that somebody had to be selected for it, that they were better than the other candidates. You might not have any other candidates, but just this idea that they have to make the case for why they're in there, and this builds up that investment. Then that may also lead into, or you can do this just without the application, one-on-one interviews with advisors. Maybe you don't know how that person really feels about the topic. Maybe that viewpoint is already represented. So maybe one-on-one interviewing with them is appropriate to figure that out. What are the roles? This is where it gets a little dicey, because at least in my nonprofit consulting days in community-based organizations, you just didn't have the money or the people to fill all these. But this is generally what the literature had talked about, that there are 5, maybe 6 roles that can be filled on the EAGs. There's the chair, the person that calls order, keeps people moving along, helps. It's usually the person with the most contextual knowledge. Yeah, we'll leave it there. The facilitator. I don't know how much I have to talk about facilitators here with you fine folks, but yeah, to have one person dedicated to facilitating the EAG. The coordinator then is the person that does all of the back-end stuff, sets up the meetings, sends out resources, does the minutes, all of these things that can ensure everybody else does their job without having to worry about that stuff behind the scenes. I was lucky enough to have a coordinator and a note taker. I always recommend note taker. It's hard to both facilitate and provide your own evaluation expertise if you're taking notes for it. And then EAG members. I call out the technical consultant here. If your program's an STD clinic like mine was, I don't know how an STD clinic works. So to get a director of an STD clinic on there is really important. Consider an external facilitator. It was talked about in a few articles here. A lot of times as internal ones, we want to lead the way, but there's value in having an external person lead the facilitation. That they're not biased by the program. They don't answer to your bosses or the people that set this up. So consider that. You'll have to pay for it, but number of articles talked about how important it was to really break down those biases that could occur. Who does the EAG facilitator report to? Yeah, I love that one. I have 8 bosses, Bob. 8. Really defining that early on. Sometimes the organizational leadership will want the facilitator to lead the discussion one way that the evaluators, the technical folks on the EAG just don't see as valuable. So just make sure that's very clear and explicit from the beginning. And now we're wrapping it up with facilitation. The role of the evaluation facilitator should be discussed and might include the following. Orient members to the project and to the evaluator's work. Develop meeting agendas. You're going to see there's overlap between this and another role. But convene the meetings, provide regular ongoing communication about the EAG work, and then be available to EAG members to answer questions. So this is all besides the normal facilitation roles that occur during the EAG, what we would consider classical facilitation, ensuring the meeting moves along, everybody's voice is heard. And then when possible, link EAG to other consultation groups to help answer any questions that come up. Questions to ask of the facilitator during this orientation training. Do members of the evaluation or the evaluation facilitator need an orientation of the program, partnerships, stakeholders? Do members or the evaluation facilitator need orientation or training in consulting in ways that are relevant, practical, realistic, and useful for the evaluation activity? Do they have all the skills they need to be on here? They might be the perfect people with the perfect knowledge, but they could need other information. And here you can see that they really start to overlap with the coordinator. But literature talks about coordinator really running the recruitment, the logistics, when, where, how often, what time are the meetings, how are they going to take place. It also talked about evaluation knowledge of EAG members as something the coordinator would ensure is adequate, equally represented. They would also be the ones in charge of, well, since they're in charge of recruiting, but how many members are appointed, who decides what members to include, how long are they going to be included. And finally, the evaluator's role, it depends. Maybe you're the contextual evaluation expert, you have a good background in this topic, or you're the coordinator of it. Like I said, this idea of facilitator is often talked about as being a good idea to think about outside. But when money's tight, it's usually all of the above. So just be sure you have enough time for everything. Okay, thank you. Give it to Margot.
Yeah, thanks, Chris.
Okay. It went away. Hold on. There we go.
Okay. Hi, my name is Margot Schmidt-Boschnick, and I'm the owner of Aspen Research and Consulting. And I've had over 25 years of experience in evaluation in a cross-section of sectors, from post-secondary education to nonprofit, and a fair amount in healthcare. In the past about 8-9 years, I've been working in primary healthcare. And right now I'm serving as an internal evaluator with the Red Deer Primary Care Network. And we're located in Alberta, Canada. Today I'm going to be talking about the evaluation advisory committees and the processes and power involved in that. Next slide, please. Okay, so I want to touch on 3 topics today. First, a little bit about the approaches and models from the evaluation literature that may be appropriate for evaluation advisory committees. And the next is to move into a healthcare context and to look at patient engagement and the literature around that. And finally, move into an example of a patient advisory committee for planning and evaluation that we had here at my organization. Next slide, please. What are the approaches and models for evaluation advisory committees? There's not a lot of literature out there that says this, this is how you should do it. But if you're going to invite people be part of an evaluation, then it implies that there is a participatory element to it. And so there's many ways to think about it. You can draw upon the participatory literature, collaborative literature, empowerment, transformative, and there's other ways that are more participatory out there that have been defined for evaluation. Next slide, please. So along with looking at a model that might be appropriate, there's also levels of engagement. And depending on the level of engagement, there's also the element of power and inclusion. I'm going to give you 2 examples from the literature that I think would work with evaluation advisory committees. And these are just 2 that I've chosen. They're not the end all and be all, but just to illustrate how they might be used, and I'll be using them in my example later on as well. Next slide. And of course, going back to what both Jean and Chris have talked about, it all comes down to context and to purpose in terms of how you choose from the literature, a model, or an approach to use. So to start with, next slide, please. The first model or approach that I had was the interpersonal participation quotient, or the IPQ, adapted by King and Steven. Next slide. And they provided this IPQ that illustrates the level of involvement in evaluation decisions and in implementation. And the continuum, as you can see, moves from evaluator directed to collaborative to participant directed. And they really focus in their description on interpersonal interaction, which is the quotient. So as the evaluator has greater involvement, then they would have, they look at it as a kind of a division problem or a quotient, so that the evaluator involvement or the stakeholder involvement, as one goes up, the other goes down, kind of thing. As with any evaluation situation, you work with the client to determine or in this case, evaluation advisory committee members or EAG members, determine the level of involvement in decisions based on time, their capacity to be involved, and resources. And King and Steven emphasize the process involved in working with stakeholders that contribute to really positive interactions and that would enhance use. So they draw on social interdependence theory and really focus on constructing processes that contribute to success for all. So you're looking at, within that, there's the dynamics of power and relationships that you need to reflect on and work through so that everyone is successful in working in the EAG. They also refer to some practical questions you need to consider, such as who should be involved, roles and responsibilities, and how do institutional structures either enhance or inhibit use. And again, those are things that Chris just referred to as well. Next slide. The second example is by Shula and al., and it's the principles to guide collaborative approaches to evaluation. They reviewed some of the literature on the models of evaluation and approaches and suggested that there needed to be more flexibility, and that's why they proposed principles. They felt that it would be more adaptable to the context. So if we looked at the actual principles, next slide please, you can see there's 8 principles, and everything from clarifying the motivation for collaboration at the top there, which really looks at your purpose, and then you're fostering meaningful relationships, developing shared understanding, appropriate participatory processes, all things that would be involved in developing relationships, and also considering power and within those relationships and taking those into account. And then you're monitoring, doing some analysis in that through promotive evaluative thinking, and where do we go from here, and then following through to realize use. So next slide. Why are these models relevant? Why should we be thinking or using them? Well, there's more frequent use of evaluation advisory committees, and there's limited literature. So what can we take away? What does the evaluation models or approaches provide for us in order to guide some? I just discussed 2 approaches or models that can be used, and again, those are just ones that I've chosen. You can look at the different models, whether it's participatory, collaborative, empowerment, depending on, again, your purpose, and draw from that to start as a starting point. Now, I want to move to my second topic here. Can you, next slide, please, Chris? And that's within the healthcare context. And because I've been working in healthcare for the last few years, this next section will be about a client or patient and example of how patients can be part of an advisory committee. What does the literature really say about engaging clients or patients in evaluation of healthcare initiatives, and what can we draw from that to consider EAGs? Next slide. So Gilbert and Cousins in a 2017 article looked at the whole concept of patient engagement and evaluation, and they suggested that the health system improvement models do emphasize patient engagement, but then there's really a struggle with the processes for those engagements and learning from improvement results that come out of those processes. There's not a lot of connection between evaluation community and the health system at this point, but they do recommend that we look at collaborative and participatory evaluation approaches that could provide some direction. Most of the efforts to this point have been evaluator directed, but as patients give more voice and become more involved in their own healthcare decisions as well as system-wide decisions, then it's important to have more of a collaborative approach. Advisory EAGs are a means of achieving this and using some of those approaches. So my next topic is moving into an example. And next slide, please, Chris. And then next slide, please, Chris. So to set the context here, next slide, please, Chris. I work with the Red Deer Primary Care Network, and as I mentioned, I'm located in the province of Alberta, Canada. We work with 86 family physicians within 19 clinics, and they have their private practices, but we help them with 36 multidisciplinary health providers, anything from pharmacists to nurses to mental health rec therapists. And we serve 124,000 patients with 25 programs and services. And just looking at some of our statistics that are coming out, we, not unlike anywhere else in the world, have rising diabetes rates, along with other chronic diseases. So our purpose, next slide, is that we wanted to increase access to diabetic education. And we do have diabetic educators or family nurses that work with people living with diabetes, but we wanted to increase the access given the increases that we're seeing in the population. We also wanted to increase patient engagement. That was a secondary part of it. So we're hoping that our design, as Jean had mentioned, how well does your EAG design reflect our purpose? And we're hoping that that worked out well. Next slide, please. So why a patient advisory committee, or EAG really? The whole province of Alberta is moving towards the concept of a medical home. So we want people to connect with a family doctor because it's proven that there's better results when you have an ongoing relationship. It could be a doctor or a clinic. And patient-centered care really means that patients are having more input into their own care and into the system. Our organization has been community focused from day one, but we want to move further along the continuum of patient engagement. Next slide, please. So we started with focus groups to look at what kind of information should we be including in this program for people. So we invited a number of people, and our diabetic educators recruited people that would be able to provide some information on people living with diabetes. They may have been through some of the programs already and within the community on diabetes, and just wondering what was missing. And so from that focus group, we asked if they would be involved in a patient advisory committee, and the majority agreed. I think we had 9 in the focus group, and we had 6 in our advisory committee. And one of whom was actually someone who was was the spouse of someone living with diabetes. So from that, they came up with that it should be a drop-in program, probably 8 weeks, and they provide input into the kinds of topics that could be addressed. And they emphasized the need for peer discussion. This just wasn't a one-way didactic type of situation. So they developed, the patient advisors advised on the content, so they're involved in some of the planning, as well as participating in the evaluation. Next slide, please. The outcomes of this program for patients or for those coming to it would be increasing access, so people could come at different times. We had increased the self-management of those living with diabetes and increased healthy living across the community. But we also had outcomes that related more to patient engagement and peer transfer of knowledge, as well as knowledgeable patient advisors. And this was building the capacity, and we hope that they would continue on in other ways within our organization to help us look at different programs in the future. And of course, a positive experience for everyone. Next slide, please. So how do the evaluation models and approaches that I discussed, the 2 that I gave you, fit for our patient advisory committee? Next slide, please. So the interpersonal participatory quotient, again, it was on that continuum. It was evaluator directed, collaborative, and participant directed. We had both evaluator directed and collaborative. Next slide, please. In terms of being evaluator directed, it really was, I was a facilitator of this. I did the overall development of the patient advisory committee, and for the processes, I built the buy-in with the management and the staff, although it was there, but just the staff weren't used to working in this way with patients. So it took some discussion and just to address any of their issues or concerns. We wanted to, and through that, building their capacity to work with the patients. I developed a very, very draft evaluation plan, but something that could be taken to the evaluation advisory committee so that they could work with it. And developing the terms of reference. What were the expectations that we had of them? What were the time commitment, or what was the time commitment? When were the meetings going to be held? And who would be involved on that? So that just put everybody on the same page as we move forward. So that was something that I drafted, but then reviewed and revised by the committee. Next slide, please. So power really rested within the organization with this EAG. We did very selective recruitment. I guess it wasn't something that we used a snowball method that Chris had referred to. The diabetic educators had chosen people that they felt could give us good information and were very knowledgeable on the topic. Time slots for the program, I know that there was discussion around by the participants, maybe we should, instead of a 5:30 to 7:30, maybe we should start a little bit later to give people time to have dinners and those kinds of things. But it really came down to, at this point in time, when our other programs were running, because we do run a number of other group programs. So those time slots were already set. Creation of the program, although they provided input through the focus group and then through some of the meetings as they reviewed the content, it really was created by the diabetic educators and the dietitian. Our meeting times were set based on when the staff were able to meet. And then the evaluation of the EAC really was evaluator directed as well, because I was trying to get a sense of their experience and where we go with this. Next slide, please. And so then it was also collaborative. And next slide, please. They were involved in co-planning, as I mentioned, in terms of providing some feedback on the content, and also co-laboring with the participatory development and implementation of the evaluation. So there was shared power there. The patients and staff decided on how to evaluate the program, right from, what are the questions we're going to use for the participants coming in on a weekly basis. So we're monitoring that, but they were also acting as a participant observers. So they developed the questions that they felt would be appropriate for those sessions, and that they were more extensive, obviously, than the participant evaluations. But they provided those and then submitted those on a weekly or when they could get to them kind of basis. And so they were doing that at each session. Next slide, please. So that gives you an idea of how those processes work within the first model that we used. In terms of the principles to guide collaborative approaches to evaluation, we had our purpose already defined in terms of the clarify the motivation, collaboration, just increase access and increase patient engagement. Fostering meaningful relationships started right from, they already had a relationship in a way with their diabetic educators, and then we were fostering that relationship through the meetings with the staff, the management, and the patient advisory committee. And developing shared understanding of the program. This came out just through the working through the content, as well as the terms of reference that we put out, and then through the evaluation. So everyone understood, what is it that we're actually trying to look at? What are the objectives here? What are the outcomes that we're achieving? Promoting appropriate participatory processes. That's the facilitation of the group to ensure that all those, everyone had a place at the table, the voices were there, and definitely that the patients were not overridden by the staff or anything, which didn't really happen. It's fairly collegial, but just making sure that everyone had an equal say in things. Monitoring resource availability, and then that wasn't a real issue for us. Monitoring evaluation progress and quality. On a weekly basis, that information came back from the participants and from the observers, and was compiled and then sent out. And finally, promote evaluative thinking. This went on throughout as we were working through the evaluation, and the people involved, actually, most of them were retired teachers, and so they were used to some sort of form of evaluation. And the final session, which we took all the data and reviewed it and did an analysis, and it was an interactive process that we came up with some ways to look at following through for realizing use. So that's how that played out. So next slide, please. Our lessons learned, really. Appropriate recruitment pays off, and I know Chris referred to this. And we were lucky with the people that came. There were some people that maybe dominated the question or the discussion, and so we had to work through some of that as well. as a facilitator, but we found that the people really gained commitment, and they also felt very, it gave them opportunity, some of them in particular, to become involved in an organization and just feeling very, very valuable, that their opinion was valuable, which was great. The staff themselves realized how valuable they were. And in the sessions, they stated that, you know, they really were advocates for the program and for in each one of those sessions. So there was relationships that was built up there. Facilitating group dynamics, ensuring everyone's voice is heard. Sometimes you'd have a phone call, and this goes back to the next one, need for ongoing contact to make sure everybody realized how valuable their input was to success. But you'd get some feedback on a telephone call and need to bring that back to the meeting and ensuring that those kinds of things were brought back, or the staff would have a comment about something, and so that we always brought that back. And I was a bit of a conduit at times to do that. So anyway, those were the primary lessons that we learned. And I think we're down to the next slide here, just a review of our topics. Basically, I've touched on some of the literature and the approaches and models and picked 2 of them from the evaluation literature that might be applicable to evaluation advisory committees, our EAGs, and looked at a healthcare context and the concept of patient engagement, and then provided a specific example from our own situation. So next slide, any questions? I see that a few have come up on the chat there, so let's just bring that up. Were there any difficulties due to privacy concerns regarding patient medical information or status, e.g. patients on the EEC may share information shared during the meetings even if instructed not to? No, we didn't really have, I guess one of the terms of reference is that the meetings were confidential, and certainly within the focus groups that's no, you know, obviously that's something that we would do, but there wasn't anything that was brought up that was really confidential. I don't think. They did share their experiences, and the people that were there all were living with diabetes or were people that had spouses living with diabetes. So that wasn't an issue for us. So I guess, no, we didn't have to worry about that. Any tips for working with the EAC or EAG that involve private information? I think in certain cases, in this instance, we didn't do confidentiality agreements and those kinds of things, but I think that might be a way to promote it and just make that as part of your terms of reference or terms of operation that you could put into place and make sure everyone's agreed on that. Certainly with any staff or volunteers coming in to our organization, they would have to sign a confidentiality oath. So that might be one way. Okay. Yes, we have full reference to the citations at the very end. And I see I'm over time here. Thanks, Jean. And I'll give this back to Chris. Or you can take it back, right, Chris? I don't need to.
And I was going to say, I did not respond correctly in chat, but if you registered for the webinar, you're going to get an email with the slides in them. And at the end, there's going to be the references. So with that, we're on our last section. Barbara was not able to join us today. She had a last minute emergency, but we were going to go through her section, and I'll try my best to give it the same level of pizzazz that she gave. So, well, I'll do the first part, and then Jean's going to hop in and do the second part. So, where did it all go wrong? EAG pitfalls and how to avoid them. You know, when we were looking through the literature, we were really surprised about the number of ways that the EAGs could go wrong. It became a little bit much, and you almost wanted to say, I never want to work with an EAG again. They're just way too tricky. but we can't. They're essential because most EAGs are made up of really nice, helpful, competent people, and many of these pitfalls can be avoided. So just keep to mind that the purpose of focusing on this darker side of EAGs for a bit is to bring forward lessons from the literature that might be helpful in avoiding them in the future. Well, see, a cute little bunny being mad. So they can be avoided. And these were the three we wanted to focus on, these sort of mock EAGs or EAGs that didn't really serve their purpose and were there for another reason. And then finally, we'll talk about EAGs and monitoring and evaluation. How can you track to ensure that these really don't happen? So the pseudo EAGs, the first one we'll talk about from the literature. Here we're talking about an EAG that's really just a window dressing. This kind of EAG is really organized around, in a way that they give the appearance that you have an inclusive and collaborative evaluation going on, but in reality, their involvement's completely superficial. Sometimes that's unintentional. Sometimes it's actively arranged to be that way. The obvious thing that comes to mind is tokenism. For example, individuals from a particular client community are invited to participate in the EAG, but no real effort is made to facilitate their engagement, and they effectively serve as a symbolic function. You know, we had this group here, aren't we so good to include them? Then there's the CYA group, C'ism, as Barbara put it. People are selected that are least likely to cause problems, or in a practice, there's enough of a power imbalance that dissent is effectively suppressed, even if that's not the intent. Even my own experience, having funders on the call with trainers caused this sort of environment that the trainers didn't feel that they could go against what the, or dissent from what the funders were saying. Or there's this idea of the punt EAG. And there's an example from one of the articles where a foundation is trying to develop this internal culture that embraces learning and evaluation. Management sets up the EAG to guide the foundation in this effort, which an insider then told the evaluators they felt was more of a cop-out. They punted the responsibility, the management did, meaning the EAG was created so that the management could pretend that they were working on culture change while setting up a committee that could have no real influence in terms on the inside culture, or which really served as a buffer against pressure for deeper change. They were just there to serve in this extra role, and no real change was intended from them. So it's important to recognize that these pseudo EAGs, whether intentional or not, they can be demoralizing for individuals who are invited to participate. It can result in these longer-term damages to relationships between the program, its peers, the community, everybody. So if you're an evaluator working often in a particular geography or with a certain community, this is not going to be helpful to you either. You're going to burn those bridges. So here are some cues that might be happening. Infrequent meetings. They happen very, very far and few between. There's some leeway in this. Once we got our expert evaluation advisory group up and running and the evaluation system running, we only met every quarter. But if there's supposed to be people that are informing every step of the process, and you're only meeting once a quarter, that's a problem. Also, there's just no dissent, or people just aren't even talking when something is brought up. The advice that is given from the EAGs is effectively ignored. There's no real effort to make action on it. The people you're reporting to just nod their head and say, oh, that's a good idea, and then nothing comes from it. Or the process is controlled in a way that encourages essentially rubber stamping. Just for example, the EAG's time is taken up mostly in procedure for formalities, leaving little time and energy for them to actually engage critically in the substance of the evaluation. They're too busy reviewing minutes from last meeting, filling out forms or non-disclosure agreements, and never get to the heart of it, although those things are important. Then the meetings, and this usually is tied in with the idea that the EAG is way too formal. It's shared to stick to the agenda when other bigger topics come to light. And it's really just designed around efficiency. Let's get them in here. Let's check that box to say we had the meeting and did these things we wrote in the grant they were going to do, but not actually give them time to think about things or talk amongst themselves in a way that's actually productive for the evaluation. And then also you could see it, and it's like the EAG could be sent detailed and polished report as just a thing that they have to do and asked to review in what, a day, 24 hours, 48 hours, and get back to them. They are invited to submit questions or feedback, but due to this short time frame, they just can't. And usually with some reference of needing to stay on schedule, right? Yeah, but feel free to give comments, make edits on this. We need it back in the next 24 hours so we can stay on track. It's just rough. So if you find yourself in this situation, advocate for more meaningful engagement if you can. Hopefully you are a voice that will be listened to by the people causing this barrier. If you think the process is constraining real input or critique, there may be opportunities to seek out other advice from members informally, one-on-one. That one. And then one author working in a cross-cultural context in the literature wrote that as a matter of principle, they follow what they call the 3 T's. They hold their sessions with EAG members on their turf, their time, and their terms. So really putting the power back into their hands. Next, we'll do the misdirecting EAG. Another common thread in the literature is that these EAGs don't always give good advice, and this can be really tricky. For example, the EAG member is simply wrong. The advice is technically incorrect. Or that the advice is technically correct, but would create serious process or political issues if it were followed. It might seem necessary and simple to them. They might not realize this wider context. For example, not all method experts have experience with utilization-focused pragmatic evaluations. And for whatever reason, that's just not the one that fits in with this particular evaluation, or at least certain steps in it. The advice that is given can be really fuzzy sometimes. It's not concrete enough to be actionable. One author reminds the reader that experts, whether they're methods experts or experts about the community context, often find it difficult to explain why they would do something a certain way. They just don't have that communication ability. As people develop their expertise at some point, much of it's internalized. They just know that that's the right one. I feel like I touched on that a little, like their methodology is the best one. It can get kind of dicey. The other members stay quiet, right? This is a telltale sign of any bad EAG. But in this particular one, it's not only that they're staying quiet, it's that they're not saying bad advice is truly bad, that they're not giving their input. You know, and as we touched on a couple times, this could be because of a power imbalance in the room. They might just assume the expert's always right. There also may be cultural issues, right? That open critique is not the cultural norm. And then if you represent a funder and EAGs are grantees, I talked about that with the trainers, right? That there could definitely be hesitancy around that. So what are some tips to avoid this? Ask why. Can they explain why? If their explanation is fuzzy, it doesn't mean they're wrong, but you just could be misinterpreting it. Seek offline input. Have those one-on-one meetings. It's hard for people to interact in groups. I feel like we all know that, but those one-on-one meetings generally work a lot better. And watch for guru worship. This is something that one of the authors, Bazerman, pointed out, that if one person, or if the group acknowledges that one person's the super expert, this guru, and everything that they say is going to be taken as gospel truth, or whatever colloquialism you want to use for that. Well, so-and-so said it, it must be true, kind of thing. So maybe understand that when you're picking people for the evaluation advisory group. And the last one we'll talk about, the undermining EAG. This was probably the most rough one to think that it exists, most disheartening one. There's a good word for it. So this is an EAG that undermines the evaluation and you as the evaluator. Most extreme here, right? Sabotage. Okay. One author described a situation where someone who had bid on the same evaluation project and didn't win became a member of the EAG. And they used this position to actively undermine some of the data collection. Then this person would go and report the data collection problems to the funder as an example of the evaluator's incompetence. So although this might be rare, it's something to keep in mind again. There's also mention in some of these articles and books about individuals who feel slighted if they're not involved in the EAG but think they should be. Maybe they're the recognized expert, but you can imagine the best expert in the field would run into the problem that we just talked about, this idea of guru worship. So if they're influential enough, they can definitely undermine it. There's the question of representation, right, or really non-representation. If your EAG is part of the public face of your evaluation, if there's sensitivity around the evaluation, then the stakeholders might look closely at your EAG to see who is represented, who's not represented. You know, this really brings up the idea of conflicts of interest, that why it's probably important to disclose conflict of interest, although don't take up your whole time doing it, as we just talked about. But because people will call those out, especially if it's an important topic that's being evaluated. So representation of groups, if there are divisions within the community, political affiliations, ethnic backgrounds, this needs to be navigated very carefully, and pull in those evaluation experts or even community experts that are experts in their own community. And the last one's really about scope. This was the one that was talked about probably the most across the articles, that EAGs can blow up your project really fast. And I feel like I feel that this happens with expert evaluation advisory groups as well. Oh, wouldn't it be good to do this? And this would really help us do that. And then suddenly you have an evaluation that costs 3 times more than you actually have money for. So how do we avoid this? You define the scope, right? Make sure that any changes that you do have to that scope are agreed upon within reason. Protect your time with it. Any collaboration, right? It takes time and patience. You need more of it during facilitation. So ensuring that you have the right amount of time to be able to navigate all of this. Don't pseudoize it, right? If you're under extreme time pressures, consider not having an EAG rather than ending up with a pseudo EAG. Only because there's no time for real engagement and listening, and then you're just wasting your time. Pay attention. That the need for extra time includes time to pay attention to all these relationships. The more people you have, the more relationships you have to manage. So be mindful of that. And look for opportunities for more flexible inclusion. Like if there's someone who might feel snubbed, take the time to provide them with updates if that's appropriate in your context, or solicit their advice separately. And with that, I will hand it over to Jean to finish out the presentation.
Thanks, Chris. Thanks, Barb. Just a couple of quick notes on monitoring and evaluation for the monitoring and evaluation advisory. Some things that Barbara suggested included, emphasis on planning, and that it'll take a lot of take you a long way toward avoiding the pitfalls. And then according to that plan, we always create a terms of reference that includes principles and composition, structure, etc. So monitoring could be about monitoring those things, and to see if everybody's working according to expectation, if expectations are comparable between the early design and the participants in the program. And she also advocated, a pre-mortem, a dark logic model approach that is, some might know it as risk anticipation and management, kind of approach, so thinking through all the likely pressures and tensions that might pull your EAG off track. And that's that's why we almost never have a exclusive expert evaluator advising committee, as Chris described. Next slide, please. And even the next one. There we go. Yeah, so, and I don't know if this is a animated slide, so it might have to need a few clicks there to get it going. Yeah, so sort of to look at the outputs early on, you know, there could be attendance, is the person indicators of disinterest, you know, so the person sending proxies so can no longer keep the commitments. Are the contributions balanced around the table? Is the time balanced correctly, or is there too much time spent on the evaluation of bureaucracy versus evaluation advice? And looking at who's controlling that agenda. Use of advice, and of course, satisfaction. As for myself, I tend to use an approach to thinking about principles of client engagement and you know, the levels of participation. Some might be familiar with Arnstein's ladder of participation. I often harken back to that in the AAC. We always program and calendar review of the EAC. We tend to use data gathered from individuals and then bring that to the group as the strategy, anonymized, of course. And we tend to ask people to look at the group dynamic in some way. I mentioned using a journeying metaphor, so we tend to have series of questions according to themes, but again, trying not to make too much of a burden of the evaluation of the EAG. But you know, design this with the client and maybe a member of the chair of the EAG or having some input as well. So in that, by that I mean we would gather quantitative data as to where we are at in a process, perhaps using a rubric type of approach, like if you're on a journey, you know, have you just left the base? Are you well on your way? Third stage might be almost there, and fourth, we've arrived. And then looking at various kinds of themes with that kind of idea, so that you gather quantitative and qualitative data. So looking at, you know, how we're doing with the purposes and how we're doing with composition, structure, engagement, are all of these things aligning, and then taking that data gathered from individuals and just feeding it back to the group at the annual review, or if it's annual. So yeah, on longer projects, you know, that's sort of 2 to 5 year, we would review the EAG itself every year. And on a shorter project, maybe, you know, on a 1 year project, we might review at halftime. And a lot of times it means getting back to individuals and checking on you know, the meaning that they attach to certain assessments. So anyway, that has been helpful in the past, and I don't have specific tools to share on that, because the tools are you know, became the property of the client as they were developed with the client. Some will eventually be published online, and when those are, if and when those are, we'll be cataloging them. So yeah, I think that's what I wanted to add. But basically, I think that that the attitude, and I kind of say it periodically too, that, you know, we didn't come here to knit, much as I like knitted goods. We didn't come here to take up space and take up time. We came here to seriously look at how we might optimize the evaluation and optimize the utilization and the impact of its results. So yeah, keeping that kind of primary purpose in mind. With that said, I'll turn it back to Chris. I think we've got, we've used our time up, but there may be individuals interested in continuing to talk. Over to you, Chris.
Yeah, thank you. So yeah, we are at time, but I think we would be happy to stay on for more questions and discussions. Like I said before, if you registered for the webinar, we'll send out the slides. And then this is also going to be recorded, and hopefully I should have a link for you to that. So yeah, questions away. Oh, all the references. Okay. Well, one more time, or hold your peace. No? Okay. Oh, yes, we will share the slides. If you registered, if not, then I will type my email in here and email me directly, and I'll be sure you get them as well. Hopefully you learned a lot, and feel free to contact any of us for probably anything. Well, almost probably evaluation related, but we'll bend on that probably too. So, all right. With that, thank you, everybody. Oh, yeah, the recording will be shared. I know it'll be shared on the local affiliate, the Atlanta Area Evaluation Association website. But you might have to be a member to get that. If that's the case, then we will also upload it to YouTube, and I will send that out and figure out how to do that. Not a problem. Like I said, if you're not registered, just email me and I'll make sure you'll get all this stuff.